now, and this presentation is something that like I'm glad we put together because it sort of like is very much like a consult and allowed me to sort of put together some like things that I think are going to help patients in general when understanding tummy tucks. So I'm glad I get to try it out with all of you guys. Okay. Well, so today we're talking about tummy tucks. Just briefly, I'm going to tell you a little bit about myself. We'll talk at like what happens to the abdomen and what are the things that people typically are coming to see me for, like what they see in the mirror, and then how we address those things. And then with each like specific procedure, well, there's a recovery process to it and what that looks like. And then finally, like who's the right candidate and what are some of the things we need to do in preparation for the procedure. And then we can look at examples. And you might see someone that looks, something like what you're, looking to address. All right. And that may help you understand the procedure a little bit better too. Okay. And then we'll have time for questions at the end. So this is me. I'm Dr. Hamwi. I did most of my training on the East Coast. And I'm a board certified plastic surgeon, which just means that I went to a residency specifically in plastic surgery and took all of the appropriate tests and did well and that kind of thing. But I'm part of a big team. So these are kind of my clinical people, and these are people that you ultimately would be in contact with at some point during the either preoperative process or postoperative process. Okay, so we're a team, and we want you guys to have a lot of resources. So I'm always available, but so are they. And then these Scarlett and Jillian are kind of front office people who you communicate with in terms of like scheduling and that kind of thing. So like I was saying, I am originally from Ohio, but I did my training at Georgetown in DC. And then I was in Boston for a little bit. And then I did another fellowship in Manhattan. And then I came back and I was actually in Indiana as well. So I did about 10 years of training and preparation for residencies and then ultimately the board exams. And then I ended up in Florida because my wife is from Sarasota. And so I always thought I was going to be a Manhattan plastic surgeon, but she had different ideas for me. Yeah, that's right. And so actually, though, even though I have ended up in little old Sarasota, we do some things that are a little bit different with our procedures, and it attracts people from all over the place. So these are all the states that people have flown in for surgery. And in fact, like just within the last 2-3 months, we had a patient who came in from Alaska. And for people who are watching remotely, we have some different concerns for local patients as opposed to patients who come from far away, mostly in regards to healing, because the healing process is typically a 6-week kind of thing before we let you go jump on a trampoline or ride a motorcycle. And not that it necessarily hurts for 6 weeks, but that's kind of before we give you our blessing. And so if you're coming from far away, you don't necessarily have to stay for the entire 6 weeks, but there are some considerations that we would want to talk about. All right, so why are we here today? Ultimately, things change, right? And so whether it's aging, weight loss is a big one these days because GLP-1 agonists, people are having tremendous success with weight loss. And so it's not uncommon to see people who have lost 20, 40, 60 pounds. And as that happens, there can be a deflation effect, all right? So between elasticity changes, things get stretched out and then they shrink, or aging just allows things to relax, weight loss, and then sometimes certain things like pregnancies that kind of stretch things out, and then they don't necessarily go back to the way they were. So what you ultimately see in the mirror is because of changes within 3 structural layers, all right? Either it is a muscle frame issue, a fat volume issue, or a skin issue, or some combination of each of those, okay? But if we look at this sort of cross section, and I'm going to come over here, I hope you can still see me. But this is the muscle layer. Volume lives around your organs. It also lives underneath the skin. And then there's the skin layer. And so people typically put a lot of emphasis on fat. They think it's fat. But in reality, each one of these individual things will have a specific result that needs to be addressed specifically, okay? So muscle issues. Muscle stretches out from pregnancies, weight gain, other surgeries. This is a patient who was not, it wasn't a volume issue. Her belly sticks out. You might think that's because of fat. I didn't do any liposuction, anything to make her thinner. I just sewed the muscle back and we get a flat result, okay? So muscle issues. Why does the muscle stick out? Well, this is sort of what a normal abdominal musculature looks like. The weakest part of the abdomen is this little line down the middle called the linea alba. And typically when people have babies, that weakest part stretches to accommodate the baby. And then afterwards, it may not come back together all the way because it's sort of like a rubber band that's been stretched out too much. It tries to come back, it might not do it. And when you get a separation like that, it's like adding a little extra surface area to my shirt. Suddenly my shirt can kind of come forward. So a little bit of pressure from behind the abdomen makes the muscle kind of bulge forward, and then you see something like this because she'd had a couple babies. All right. This is a demonstration of that separation in a really skinny person. Okay. Fat issues. So volume, and I like calling it volume, but I like calling it fat because that's sort of how it works. The volume can be underneath the skin, which is typically stuff that you can kind of pinch, but it can also be around the organs. And the significance of that is we can do something about the stuff under the skin, but stuff underneath the organs, like no surgeon is going to cut that out or remove it, okay? That needs to be reduced before surgery so that we can get the best results because that stuff pushes out like a baby, okay? And so if you've got, this is called visceral fat. Do I have the picture? I'll have a picture later. If you've got a lot of visceral fat, then it may not be something that's correctable with the tummy tuck, all right? Another way to think about that is, we were talking about closing that muscle or tightening that muscle that's been stretched out. Well, if there's a lot of volume there, it's sort of like trying to close a jacket that's too small, all right? Or if I had a big pillow here, I couldn't get my jacket around it. But if I take that out, suddenly my jacket closes really easily and I can get a better result. So this is a patient that her primary issue was volume, all right? Like we didn't end up sewing her muscle because she hadn't had kids. The muscle was intact. And so by removing this and kind of pulling things flat, we can give her a nice flat sort of small result. And we don't need to address the muscle, okay? So when we're looking at a patient, you try and figure out what the anatomy is so that you can pick the right technique. Yes, that's right. And then skin issues. Skin issues are often overlooked because, I don't know, everyone sort of blames fat, all right? But the skin is super important. It's sort of like the paint on the car is the analogy I like to use, is that you can have a Ferrari, but if it's rusty, like you might not appreciate it for what it is. And so this is a patient that had lost some weight, and as she did, the skin kind of had this deflation effect. And so again, young, not a lot of volume, skin. A tummy tuck that addresses the skin is best for her, okay? All right, so we look at the individual structures, muscle, fat, and skin to pick the right technique. Tummy tucks are really good for muscle and skin issues, okay? If it's a volume issue, that probably needs to be addressed beforehand, or maybe like a tummy tuck isn't even necessary. Like in some patients, if they've got really good skin elasticity and the muscle's intact, they're like subcutaneous fat layers a little too thick, well, liposuction might be a reasonable thing. I do that too, absolutely. But if you've got a muscle or skin issue, liposuction isn't going to cut it, okay? In fact, it can sometimes make things worse because if you take something where it's a skin issue and you take more volume out without addressing the skin part, you've essentially deflated the skin more. So when is a tummy tuck not the right option? Muscles intact, good skin elasticity like this patient. She's young, her skin's awesome, the muscle hasn't been stretched out. This is a liposuction patient, all right? When the problems only arise when you sit down, right? If you sit in a chair and you get some skin folds, like that's normal, right? Like that's what's going on in this photo. Or when the volume is the only issue. All right, this is a weight loss patient. All right, and now in the age of Ozempic, like this is someone that I would say, hey, listen, like I'm a surgeon, I love to operate, but like I'm not the guy for you. All right, and there are some really cool options out there these days that you know, are non-surgical. That would probably be a better option. Okay. All right, so let's talk about tummy tucks, how it's done. So general anesthesia, you go to sleep so that like you don't feel anything, hear anything, you wake up, it's over. It's done at an outpatient facility. I've got privileges, not here, but I've got 2 sort of outpatient facilities that I like to work out of. I also have privileges at the hospital. We rarely do the hospital because the prices are usually prohibitive. And quite honestly, if you are not healthy enough to have this procedure in an outpatient facility, yeah, we shouldn't be doing it. Okay, like this is for people who, you know, don't have health problems. And you go home afterwards. And so we want you up, moving around, sort of like when women have babies or C-sections, they kick them out of bed the same day. All right, that's important. You want to get up and you want to move around so you can decrease the chance of blood clots in your legs. Okay, so the first, or I'm going to break this down to some very simple technical sort of things. But the first part is the incision. So an incision that typically goes from hip bone to hip bone. In reality, the incision is tailored to wherever the loose skin is. There's also a geometry component to this, where in plastic surgery, however tall the amount of skin is that you're removing, you need it to at least be 3 times as wide. All right? 3 times. They say 3 to 4. In tummy tucks, we try and keep it 3. The reason that is because if it's not wide enough, you're essentially imagine trying to close a circle, okay? If you close a circle, it squishes everything out to the sides, and you get something called a dog ear, all right? And so how do you fix a dog ear? You fix a dog ear by cutting it out, and that extends your incision. And you end up making your incision what it should have been in the first place, which is about 3 to 4 times the height, okay? But you'll notice that there's an incision that goes down here, and then it also goes around the belly button, because when we pull things down, we don't want the belly button to come with us, right? We want the belly button to stay where it is, okay? We lift things up, and now we're looking at the abdominal musculature, which allows us an opportunity to close that if necessary. If you remember that separation down the middle, it's sort of like my jacket came apart. Well, we're going to button the jacket, all right? So that can or can't be done depending on the need of the patient, all right? And we're finding that as people are losing more weight and that visceral fat is shrinking, even people who've had babies don't necessarily need the muscle plication nearly as much as we used to do it prior to the GLP-1s. So the advantage of not sewing the muscle, quicker recovery. Okay, muscle is usually like the tender part of the procedure. And I've got some things to help like mitigate that. But in general, people who don't have the muscle sewn, they are sort of like, we see them kind of skipping into the office like the next day. So then after you've sewn the muscle, then you pull down the tissue, all right? It's sort of like the sheets on the bed, right? When the sheets are all sort of like, you know, or my shirt, there's too much. So if I go like this, it's nice and smooth, all right? And so if you'll notice in this, I love this image, that's where the belly button used to be. This is all the extra stuff I don't need. So that comes off, goes in the garbage. And then a new little hole is created in the skin. And when you remove that, the old belly button is sitting right underneath there. You bring it up and you sew it to the surface. Okay? And so this patient, this is just sort of like an interesting demonstration. But if you notice, see that mole right there? That's that same mole over there. All right? You pull it all down. Okay? And the belly button, the skin that we removed was like this. That goes in the garbage. So, yeah, if you'll notice, that mole is, you know, that one over there. And because that's all gone. Okay? And then finally, we sew everything up. And so there's sutures that go everywhere that we made the cuts. Now, we use absorbable sutures, so they're all underneath the skin, and so there's no sutures that need to be removed. Okay? None. Now there are drains, but the sutures themselves, the body will break down and they just absorb. Well, wherever you make an incision in the skin, you see a scar. Okay? You will get a thin scar. Typically that scar is small. It can be wide, and that's based on 4 things: your genetics, how much tension is on things, the part of the body. Faces heal really well. Breasts and bellies are kind of middle of the road. Arms and legs, not quite as well. And then the surgeon, how good a job I did. Okay? But specific to tummy tucks, and this is just sort of a little interesting aside, but sometimes people come in and they're like, look how great my C-section incision is. This will just look like a bigger version of that. I hope so, but not necessarily. Okay? The reason that is because a C-section, the healing environment is different than a tummy tuck. Incisions don't like to be pulled apart. And when you have a tummy tuck, you're pulling things down and they're tight. In fact, we pull them so much that sometimes we have to bend you forward. In fact, we anticipate we do bend you forward. And you slowly have to let that stretch out. Okay? And incisions don't like to be pulled apart. So, yes, I do a bunch of things to try and get the prettiest scar possible, but it drives plastic surgeons nuts because sometimes C-section incisions look prettier than our tummy tuck incisions. Okay? That's exactly right. Yes. Yep. And I'll talk a little bit about that here in a second.
Just above the pubic area.
Can I mute this? Is that in here? It was screaming at us before. Perfect. All right. This is a little video of what I just described. So, incision down here, they're sort of showing that we tend to put this in places covered by underwear and bikinis. You'll also notice the incision around the belly button. Lift it up. We're looking at that muscle. Can sew it, cannot sew it. If you do, the idea is that it kind of brings that back. And then the skin's pulled down. Make sense? Sheets on the bed. And then trim off what you don't need. Sew it all back up in the areas where the incisions were created. Okay? You're talking about it like the lateral aspects of the incision? It does. And I would say that that is less common. Okay? Usually it's hip bone to hip bone. But if you needed it further, then we would do it further. What you don't want to do is, if you've got a skin fold that goes out to here, you don't want to stop here and then leave you with extra looseness over there. So it's worth the extra scar to have a flat, even result. At least I think most people would say that. So recovery, usually 1 to 2 weeks off from work. What we usually tell people is, if you have a desk job where you work from home, well, you could probably do that after a week. Okay, the first week, I don't know, you just don't want to be harassed. If you have a desk job at an office, well, then you probably need 2 weeks off. If you have a strenuous job where you are on your feet a lot, like a doctor or a surgeon, I recently treated one of my friends who's a plastic surgeon, and they took 3 weeks off. Okay, so it kind of depends on what your obligations are to your work and your family and your life. Okay, but usually we tell people to take 2 weeks off. All right, 1 to 2 weeks off from driving. The reason behind that is we're going to give you narcotics. And so we don't want you, if you're on pain pills, we don't want you on the streets. And we also want you to feel like you're unencumbered by, whatever happened, so that if someone cuts you off, you can swerve out of the way. 1 to 2 weeks of pain medicine. Usually people like to have those for the first week. The second week is kind of patient dependent. 6 weeks off from the gym. The body glues itself together over 6 weeks. We know that collagen doubles in strength every week over that month and a half. So you go from everything's held together by just my sutures to at 1 week, it's 5% of its healed strength. At 2 weeks, it's 10. At 3 weeks, it's 20, not very much. 4 weeks, 40. 5 weeks, 80. And then at 6 weeks, 100%. So that's where that 6 weeks comes from. Now, 6 weeks will get you physiologically healed, but there will still be some like nuisance things that you're dealing with. So a little bit of residual swelling, some numbness, or like maybe things don't feel totally normal. That stuff goes away over months. But from a strength standpoint and a like go live your life standpoint, 6 weeks. The one caveat to that is if we sew your muscle 6 months before we let you do sit-ups, squats, things that directly engage the core. Because we want that repair to be really, really strong, okay? And so you can go to, the gym and do the treadmill. You could jump on a trampoline or ride a motorcycle, but you can't do squats, okay? All right, so let's talk about recovery a little bit. So you had mentioned something about the bending over, all right? And the reason that is because here's my belly button right about, there. I have to get this skin above my belly button down to my underwear line. And if I pull on my shirt, it just doesn't want to go. So how do I do that? I bend you forward, all right? And we sew it together like this. But when I do that, you can't stand up all the way or else you're pulling on the incision line. And that's one of the things that incisions don't like. In order to get the prettiest incisions, you don't want to pull on things. So we sew you all together and we say, go home and I want you to sleep in a little bit of like a bend, which means a couple pillows underneath your knees and a couple pillows behind your back. And when you're walking around a little bent over, all right? You do that for a week. And then after that, then we start letting you stand up straight. And over that second week, you get erect. And so when we were talking about like when you can go back to work, that's part of why, like if you're in an office, it's probably 2 weeks before that's a reasonable thing, okay? 2 weeks of drains, all right? I'll describe this here in a second, but when you lift the fat and the skin off of the muscle, it needs to glue itself back together, all right? And while it's doing that, if the body puts some fluid down in there, well, then those two layers aren't touching anymore, right? And so they can't glue themselves together. So the drains go in to allow the tissue to glue itself back together. I do something that we'll talk about here in a little bit later that encourages that to happen a little bit faster, but I still use drains so I can prevent a seroma, which is a fluid collection, okay? And then at 3 weeks, we typically tell patients they can begin scar treatments. The idea behind that is that in the first 3 weeks, your incision is like a fresh cut. And you don't want to be rubbing like lotions and things into a cut. Once you get to about 3 weeks, now it's like a fresh scar and you can start doing scar creams and scar treatments. And in reality, scars remodel over like months and years, but the more you kind of protect them in that early healing portion, the better set up you are to have a great sort of scar afterwards. All right. Follow-up visits. So you're not left to your own devices. All right. I like to keep a really close eye on you guys. So we have everybody come back 1 day after the procedure. All right. This allows me to check all of my dressings and to make sure you understand everything. Drains sometimes can be intimidating to people, so this gives us an opportunity to sort of review that and just make sure that like you guys understand everything you need. Then we have you come back at 1 week. We do a dressing change at 1 week, and then we do the same and we remove one of the drains. We have you come back at 2 weeks. We do another dressing change, and we take out the other drain. Okay. The whole dressing change thing, I've got something that's a little bit unique in regards to that too. Can you grab me a Pico? Yeah, sure. And so the nice thing about the dressing that I put on you is that you don't have to do anything, and we only have to change it once a week. All right, and it gives us prettier scars. I'll talk a little bit about that in a little bit too. Then we do 2 weeks after that is 4 weeks. It's kind of just to check in, how you doing? You got any questions? Everything looking the way you wanted? Is the swelling going down? And then we have a 6 week check-in, which is the physiologically you're healed. go live your life, go back to the gym. Cool. Awesome, awesome. I'm going to save this for later. We'll talk about it a little bit later. So what are some like sort of unique or like interesting things that have evolved in plastic surgery and that we can do to have better outcomes? Well, Exparel is a numbing medication that is wrapped in a fat molecule. And so we inject this into the muscle, and the fat slowly dissolves and releases the numbing medicine over 3 days. And so we get this lidocaine effect like the dentist does that lasts for 3 days. It's amazing. I love it. And so I started using it like, you know, for patients who asked for it. And now I just use it on everyone. It was great. Progressive tension sutures. This is an advanced technique. It was sort of just coming into favor when I was in training. I hope and think everyone is using it now, but I don't know. The idea of progressive tension sutures is we talked about how incisions don't like to be under stress or tension. So if I take that layer of tissue that has been released and I sew it back down to the muscle, well, look, this is under tension, but this part isn't, okay? And so I march down and I put these sutures in that then take the tension off of the incision. Now, not completely, but it helps. The other thing it does is, remember we were talking about how those two layers need to glue themselves back together? Well, if the tissues aren't like gliding on themselves, they will glue themselves back together faster. And so typically drains come out faster, and the body just kind of heals a little bit quicker. Yes, sure. Negative pressure dressings. So wound vacs were developed for big nasty wounds and diabetics or like non-healing ulcers. And they found that if you suck down on these things, that negative pressure actually signaled to the cells to heal faster. And things that wouldn't heal and had been like wounds for a year, suddenly you would watch them close in front of your eyes. It was magic. It revolutionized wound care. Well, they started putting these on incisions that they expected to have problems, radiated tissue, smokers. And they found that not only were the incisions not opening up or breaking down, but they were actually healing prettier. So they came up with a cosmetic version of the wound vac, and this is one by Smith and Nephew called the Pico. And so it is a big sticky Band-Aid that sits over top of a closed incision, okay? So it's not a drain itself. This just sits on the skin, okay? But it's got this perimeter around it that is made out of silicone, and it's airtight and watertight. And so if you suck down on this, it can create a vacuum and create that negative pressure that the wound vac was essentially creating. And so they found that if you suck down on tissue at between 80 and 125 millimeters mercury of negative pressure, that was the magic amount that made the tissue heal. And so this little pager looking thing constantly is sensing the pressure in the dressing and adjusting it to keep it at 80 millimeters mercury. And so this goes in your pocket or clips on your belt or whatever and sucks down on the dressing. Then a week later, we take it off, we clean everything, and we put another one on. The box lasts for 2 weeks, but we can't leave it on for 2 weeks. We got to see what's going on underneath there, make sure there's not like something brewing. All right? So that's what happens at that 1 week and 2 week visit. All right? So negative pressure dressings. And then we've got all sorts of post-operative scar treatments, and that's actually a whole nother talk, okay? But we start looking and talking about those at usually about the 3 week visit, so that we can kind of set you up to have the best possible, outcome. So who's a good candidate? Stable weight or close to target weight. This comes down to that idea of like volume reduction and being able to get the best like possible result. Because as you shrink, well, things become looser and you can sometimes pull out a little bit more, right? You also don't want to do this before you lose weight, have everything looking all amazing, and then lose 20, 30 pounds, and then you have that deflation effect come back. You want to do this one time, right? And so, 5, 10 pounds, probably not the end of the world. 20, 30, yeah, lose that first, okay? We also know that these surgeries are safer in people who have lower BMIs. There's a direct correlation between issues, risks, and BMI. And so they typically say that a BMI of 20 or less is like the best. 25 or less, still pretty good. 30 or less, okay. 35, we need to, like, for safety reasons, at least get that less. But then also cosmetic reasons too, all right? Non-smokers, smoking, or it's not actually smoking, it's nicotine. So patches, gums, all that stuff is a disaster. Nicotine is actually a medication, the molecule that causes vasoconstriction, meaning that the little blood vessels that perfuse or bring blood and oxygen to the tissues clamp down. And one cigarette or a gum can actually create like a month of vasoconstriction before you get back to normal. So if you're a smoker or use nicotine products, you got to stop it or else the tissue will die and you'll get a bad wound, and that would be sad. Yeah, there you go. Right. And this is all part of like a journey to live your best life. Adequate time off. Find the right time in your life, right? You don't want to do this when you've got like a big presentation that you need to give, or you're going to be speaking at a wedding, right? That body needs 6 weeks before we like let you go free. So find that time where you've got like 6 weeks where like life is pretty mundane. It doesn't need to be, I don't want you on your butt for 6 weeks, but I just don't want you in a situation where you feel like you need to exert yourself. Having good assistance during the recovery. So get your team together, all right? For that first week after the procedure, I want someone who can kind of be there with you and help you out of bed so you're not having to throw yourself. You've got some big, long incision, and we don't want you to have a bleeding event or something like that, right? So someone who can help so you're recovering in a controlled way. And then planning around important events. That was sort of that same idea of like if you've got something that you want to be tip-top for, at least a month and a half before. So patient examples, all right? So these are people who have had tummy tucks, and you'll notice that like not everyone looks the same when they're done, right? Certain body types will have certain results. And this is another reason why sometimes like losing weight and getting the other parts of your frame the way you want them give us a better overall result. This is a patient with a little bit more volume and a little bit more of a square sort of torso, and afterwards she's got a little bit more of a square torso. Whereas this person, you see, she's like, her torso is a little bit more curvy, and so, afterwards it has a little bit more of a curvy torso. This is a really skinny person who their issue wasn't really fat or muscle, it really was mostly just kind of skin stuff. Over here's a person whose issue was really muscle stuff, right? She's younger. This patient was in her 50s versus someone who's in maybe their 30s, right? Another example of muscle in a younger patient. That's probably muscle and volume. Another thing about volume in general is when you take the skin and pull it down, it does sort of like make it a little bit thinner. All right. So, and we don't need necessarily to do liposuction in order to get a result like that. Just sometimes pulling things tight kind of stretches that out. So, preparation for the procedure. Everyone comes in, we meet, we have a consultation, we look at you and what's going on with your anatomy so that we can kind of talk about like what the technique would look like. We can let you leave with a quote so you kind of know what this costs. And if it sounds like something that you want to do, then you can talk with Scarlett, who's my office manager, or Juliana, who does our scheduling. You find the right time in your life. You find something that matches with me and the surgery center. And then we say, all right, let's make sure that we're doing this safely. So we send you out and we ask for preoperative clearance. So if you have a primary care provider, they would just say, all right, yes, it's good to see you, Mrs. Smith. You look healthy. Your medical issues are these, but they seem to be under control. We need an EKG typically if you're over the age of 50, and we need some routine lab work for everyone. We're looking to make sure that you're not anemic, that your kidneys, your liver function appropriately. So if we give you medicine, your body can get rid of it. And then as we get closer to surgery again, you come back to the office. we just kind of do like a pre-surgery huddle. It's an opportunity to put you in the front of my mind, for you to ask any questions that you may have come up with in that interval since we originally saw each other. And then the next time we see each other is at the surgery center. All right. You then, after the surgery, go home, and then we get into that whole sort of like structured follow-up thing where you see me the next day and then 1 week and blah, 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 blah. And in preparation, we actually will go ahead and schedule all of your follow-ups prior to the surgery. So you just put them in your calendar, and so that you can be all ready for everything. We want this to be really structured. And then you go live your best life, right? Once we get you to 6 weeks, we want you to put this behind you. All right. Like I said, there may still be some like little, swelling and stuff like that to deal with. But the idea is that this is quality of life stuff. All right. So we don't want you you do it and then go pick out an awesome dress. So I don't know. This is just like a patient that is really close to my heart. It's just kind of inspires me, and I see her and she looks so good. And every once in a while she'll send me like a update on how she's doing. But this is someone who had been through sort of like a weight loss journey. There had been some tissue laxity that developed as she lost the weight. But, when you do something like this, it just is very motivating. And you can wear the dresses you want, and you can get the outfits. And if you've got that thing in your closet that you've been dying to wear, but it doesn't quite fit right, to be able to put that on and feel confident, that's why we do this. This is quality of life surgery. So if you have something that's a hang up, I want people to know that there are options, and this should feel right, and you shouldn't feel pressured into it or that you're doing it for anyone else. But if this is going to make you feel good, well, it's out there. Okay. If you're interested in consultation, call our office, email us, whatever, you can find us. But we're happy to get you in, and we can look at each individual case. If you are from out of town, we do virtual consultations. I can tell a lot from photos. We'll have you send those in. We can set up a Zoom call or even just over the phone in something. And oftentimes, even patients who are local sometimes find that more convenient. And then if you just want to get some basic information or dive into some of the things I talked about a little bit deeper, I'd love to see you. I can oftentimes talk a little bit more specifically if you come in, but I also, like I say, I treat a lot of people who are from other places. So that's kind of that. Google Florida plastic surgery if you need to get in touch with us.
We have a question.
Yeah.
If you're an out-of-state patient, how long do you need to stay around here post-recovery?
Right. So for out-of-state patients, typically I tell people at least 2 weeks. 3 would be even better. Now, here are the reasons that we would want you to stick around. 1, we got to get those drains out. I was actually talking to a patient recently who had a tummy tuck in Miami, and they had sent her home a week later, and she pulled out her own drain. I don't know. To me, that sounds like a lot. And in those first 2 weeks, if you're going to have an issue, that's when it's going to reveal itself. And so I just like to have people close enough where, if I need to look at something, just come on into the office. And so I've been lucky in that I haven't had any major issues with people who have gone home, but you're always rolling the dice a little bit, and you need to be in an environment that isn't austere, where you have access to an ER or a wound care clinic or a doctor, in case there is any hangups. Because while the risks are low, some of them can be, a big deal, and you don't want to overlook them or not plan for them or not be sort of set up to do well. But you come back 1 week to remove that drain, that 2 weeks to that second drain. So 2 weeks, I think, would be sort of the minimum amount of time that I'd want you to stay here. The other thing to consider about people who are coming from out of town is one of the, I would say the dreaded risk in tummy tucks is a pulmonary embolism. It is a blood clot in your leg that breaks off and goes to your lungs. There are not many things in plastic surgery that can kill you, but a pulmonary embolism is. It can be lethal. And luckily I've never had that, but general anesthesia, regardless of the procedure, is a risk factor. So is traveling on a plane long distances. In fact, I had a mentor when I was in residency who went on a trip to Europe, and he got a DVT or blood clot in his leg just from sitting in a plane like on a really long trip. So if you're traveling from far away, Alaska, you need to get up and you need to walk down the aisle every hour. Okay? So anyway, I'd make a big deal out of that and I harass my patients about that a lot. Sorry, that's my soapbox. I'm about to go into questions, but I've got I've got a bunch of other slides, but they're really more just to kind of dig into some of the specifics. So do you guys have any questions?
Can you touch on the lipo?
Liposuction. Absolutely. So liposuction as part of a tummy tuck or independent? Right. Okay. So liposuction is a procedure. Let's just use let me go back to here. If we look at the layers of the abdomen, liposuction is for treating subcutaneous fat. All right. You make a little incision that's about the size of a grain of rice. You pump in some numbing medicine with some vasoconstrictors in it, and then you use a little tube to remove the fat. Liposuction is great at removing fat. It doesn't do anything for muscle, and it deflates the skin. So you have to be that patient. All right. Today I treated a 50-year-old with a little bit of like a abdominal, like a little protuberance of the lower abdomen, but he didn't have a skin fold. And we had a really frank conversation about skin laxity afterwards and whether or not that was like a reasonable outcome. Because I know that his skin isn't going to do what that woman's did. Okay? So I say if you are less than 35, liposuction is totally on the table. Above 35, we need to have a frank conversation about like what the outcome is. Now, not everybody needs a flat, perfect abdomen. And some people are super tolerant of like extra skin. But what we found is that if you're above 35 and you have like a skin fold, it will shrink, but the fold won't go away because there's too much skin.
So do you do paniculectomy?
Yeah. All right. So a paniculectomy. Sorry, I don't have a slide to show you.
Okay.
But what a paniculectomy is rather than pulling down the skin, we leave the belly button where it is, and we just trim off this. Okay? So paniculectomies are for people that have skin folds that kind of hang down. And we just want to take off the skin fold. All right? So the volume that kind of hangs goes in the garbage. Paniculectomies are great functional procedures. They tend to not like look as smooth and tight as as a tummy tuck.
So what I was thinking is lipo and then paniculectomy.
Yeah. The problem with liposuction is that unless it is just isolated to the lower abdomen, right? If you're doing liposuction here, you're getting deflation throughout the abdomen. And so just removing the pannus, you still have the extra skin sort of everywhere. Maybe. Yeah.
We have some kudos. Someone said the tummy tuck recovery is a breeze, and another said, "I wish I could tell everyone there to do it. It's like choosing a doctor."
Oh. Well, thank you. Yes.
So before the surgery, in what time frame before do we have to see our general cleared? Like how?
Right. It depends on like the medical condition. There are certain things that, if a cardiac condition, I would like that within a month. But if you are a relatively healthy person and like nothing has changed in 6 months, well, 3 months is probably ideal within 3 months. Yeah, I would say, yeah.
The fat that your skin, I should say, you're pulling down from above the belly button. You have to, it is attached, is it not? Like you have to separate that and then pull it down?
That's right. So you actually release things all the way up to it's called the costal margin. And this point right here is called the xiphoid, right? It's kind of like the bottom of your breastbone. And so, yes, we have to, it's sort of like the comforter is glued to the mattress. You got to lift the comforter up so you can pull it down.
Think of putting the butter underneath the chicken skin,
Yeah, okay, right? Yeah, that's right.
When you put all the marks and everything on, is it on the day of?
Mm-hmm. So on the day of the procedure, we meet in the preoperative area, and I'll do my little markings, okay? Hopefully at that point, like all your questions are answered and that sort of thing. This is kind of like go time, but like, yes. And I mean, I've done so many of these. This is, just kind of routine stuff, but I will put the appropriate markings on. You'll get an IV, and then they go to the surgery room. They'll put squeezers on your legs that help maintain your circulation during the procedure and give you some antibiotics through the IV. And then you'll be asleep before I do anything. And I load you up with numbing medicine before I do anything. Okay?
You usually do surgeries in the morning?
Yeah, we start early. So the first patient is usually, they show up at like 6:30 in the morning. Tummy tucks take about 2 to 3 hours. We typically book them for like somewhere between 3 and 4 because there's the anesthesia has to do their job, and then there's the waking you up. So, but like the surgical part of that is like usually 2 to 3 hours.
How long after the surgery are we there?
Yeah, usually like an hour. I mean, they want to check your vital signs and make sure you're comfortable and that everything is normal. You walk out. That's right. Now, I will say I have like a closet full of walkers, and not everybody accepts them, but I offer them because a common complaint that I was getting was that your lower back hurt from that first week of kind of walking around like an old lady. And so I offer that if you want it.
So can you touch on where the operation in your different locations?
That's right. So outside of the hospital, I use outpatient surgery centers. They're both in Bradenton. One is like a freestanding surgery center. One of them is at a colleague of mine has their own surgery center in their office. And it's largely based off of, the availability and trying to coordinate with like your schedule, my schedule, and like which one of those is available. Yeah. Cool. Well, thank you for your time and attention. And like I say, like I love this procedure. It can be really profound. And opportunities to just stand up here and kind of talk about it are energizing for me. And this presentation, I think, also will help other patients in consultations. So if you're interested in a consultation, please feel free to reach out. Okay. Yeah. Thanks.